Hi, and welcome to Movie and a Massage Therapist. I'm your host and massage therapist, Sherry Moser. Tonight, we're going to be watching a real drama called Tingling in Weakness, where our lead character, Romeo Rockefeller, is on a journey to find out why he has thoracic outlet syndrome and what it is. Today in studios, we're also going to be following along with our own case study to see what we can learn from the movie. Stay tuned and enjoy the movie.
Good morning, Trixie.
Good morning, Emma. What does my schedule look like today?
Well, let me check. Looks like, you have 4 appointments scheduled today. Very busy, that's good. Yep, 4 appointments today.
Okay.
Here you go.
Thanks. Are they all new clients? Do I have some repeats?
You have your 3 regulars, of course, and you have 1 new patient. He called in first thing this morning, very desperate.
Can you tell me a little bit about
Oh yeah, I took his voicemail. Sexy voice. So his name's Romeo Rockefeller, and he said that he had some strange numbness and tingling in his forearm. And he said that he has slight discoloration. It sounds disgusting. Anyway, he said that he has generalized numbness all throughout the arm. I don't know what that is, but it sounds gross. Anyway, he called. He wants to see you first thing this morning.
Oh my.
What is it?
Emma, it sounds like we have a side case of thoracic outlet syndrome.
Oh. I'll tell him when you're ready.
Welcome back to Movie and a Massage Therapist. Today we're going to go over our own case study. Our case study is a 32-year-old male with generalized numbness, weakness, tingling, and pain to the arm, forearm, and hand. He also has a slight discoloration in the forearm. He did go see a physician, and he was told by the physician that he has thoracic outlet syndrome. Now, what is thoracic outlet syndrome? Thoracic outlet syndrome is a neurovascular entrapment of the brachial plexus or blood vessels that run to and from the arm. They are somewhere impinged or entrapped at thoracic outlet. Now the thing about thoracic outlet syndrome is it's quite tricky because there are a lot of syndromes out there, as you can see, that have very similar or the same symptoms. Some of those include carpal tunnel syndrome, costal misalignment, cervical vertebrae misalignment. A few others include pectoralis minor syndrome. A lot of times thoracic outlet syndrome is caused by a traumatic experience, a car accident, or sometimes clients having the collarbone broken. Now in our case, Romeo did have his collarbone broken, but he also had repetitive stress injury. Let's get back to the movie and actually meet our lead character, Romeo. Romeo, I'm
Nice to meet you.
Trixie. Please.
Trixie. Oh,
down.
massage therapist?
Yes. Please sit down.
Thank you.
Well, thank you for coming in today. Emma was telling me that you...
Emma, I like her.
She is quite
Good
nice.
receptionist. I scheduled with her this morning. This
pain,
pain in my
right?
arm, yes.
Go ahead and tell me a little bit about that.
It really hurts a lot. I cannot sleep. I cannot eat. I have almost no feeling in this arm. It's so painful. I'm upset about it.
I can tell. Do you have any more, specific symptoms besides?
Well, it was a very traumatic incident. A little uncomfortable talking about it. But I'm having some numbness and tingling in my arm.
Okay.
It's very painful. I also have this strange discoloration right here.
Oh! Yes, just... yes, right there.
It hurts a lot. It's very...
Right,
It's very strange, this discoloration. Sorry, it was due to an incident that I do not wish to talk about. It hurt my feelings.
I'm sorry about that, but maybe Emma was also mentioned something about you went to see a doctor.
Oh.
What happened there? Tell me what he said.
I mean, it was very... I do not want to talk about that. It's very uncomfortable.
Okay, well, Romeo, I'm here for you. Just take your time. Tell me what happened.
Okay, Trixie, is it? I'll start from the beginning. honey. Ugh, please.
Oh,
Oh, hello, Mrs.
hello,
Bradfield.
Romeo.
Oh, hello.
I've been waiting for you.
Oh, well, I have your
all
mail.
day.
That's good. I'm the mailman, so I have your mail.
Oh.
Oh, excuse me.
No.
Oh,
You look tired.
I have
Let
to
me
get-
get that for you.
oh,
Excuse me.
thank you. Thank you, Mrs. Bradfield. It's very nice.
You look tired and thirsty.
I
Would
actually
you like a drink?
am good. I had a lot of wine this morning, and I cannot drink anymore. I'm so drunk.
Oh.
I must continue to deliver the mail. I cannot converse with you.
You're turning me down?
Oh no,
Me?
you look
How
ravishing
dare you?
today.
You
Ravishing.
stupid little mailman!
I-
You think you can
no.
turn Mrs. Bradfield down?
Miss Bradfield,
Out of
I don't
my way,
have-
you stupid little mailman! My collarbone! I'll never deliver the mail again! Wow, that is what I call a tough day at the office. Poor Romeo. Now let's talk a little bit about what's involved in thoracic outlet syndrome. The involved anatomical structures. First, we have our musculature that's involved. The main ones are pec minor, anterior scalene, and middle scalene. The main bony structures are the clavicle, the first rib, and occasionally the cervical vertebrae. The nerves and the vessels that are involved are the median nerve, the brachial plexus, the axillary artery, and the subclavian vein. Now, if you look at this from a holistic perspective, you really have to look at the whole body. There are other structures that you will need to take a look at as a massage therapist. That would be the sits muscles, trapezius, subclavius, SEM, levator scapulae, pectoralis major, and rhomboids. Now that might seem a lot, but it's important for your client's well-being. Now let's get back and see how Romeo is progressing. Enjoy the movie. Oh, Romeo, you poor soul.
It gets worse.
Worse?
Much worse! My arm was so painful I couldn't work. I couldn't deliver the mail. That woman. That trickster. No pun intended. But she was awful to me. She took away my life. I couldn't feed my kittens.
Oh.
It was terrible.
That sounds...
They sent me downstairs. This might not mean anything to you, massage therapist, but I was in the sorting room. That's nothing. I was out delivering the mail and then down, nothing. Your arm hurts? Go to the sorting room. I was typing. All of a sudden, I wasn't proud. I wasn't delivering the mail. I was rolling my shoulders forward and developing a forward head carriage. Oh, it was painful. My back started to hurt and I became decrepit.
Oh, well, is that when you decided to see Dr. Strickland?
Dr. Strickland, oh, I did. I went for help,
And?
and all he wanted was, no.
Oh, please, Romeo. Tell me what happened with Dr. Strickland. Tell me.
Dr. Strickland, is there anything else you can do for me? Anything? My arm is killing me.
Well, Romeo, there is one thing. But you're not gonna like it.
Dr. Strickland, tell me.
Fine.
My arm is blue.
I'll tell you.
You wait right there.
There is one thing I can do. I need my tools.
Dr. Strickland, what are you doing there? Dr. Strickland?
Oh,
My arm is blue.
Again! Complete amputation! Romeo, did the doctor at least tell you where your pain is stemming from?
Yes.
Or what type of TOS you have?
Dr. Strickland was very clear about that before he tried to chop my arm off. He said that my brachial nexus, it was being compressed by my neck muscles. How ridiculous is that? I did not like that. Yes, brachial nexus. He was very, very specific about that. My neck muscles are pressing on it. It's, right now,
Are
they're
you sure?
pressing my neck.
Romeo.
Yes.
You sure it
Yes.
wasn't brachial plexus?
Yes, that's what I said. The brachial plexus it's compressing. It's hurting my brain. I cannot think.
Okay, well, don't worry, Romeo, because Here at Healing Hands Massage Therapy, we don't use chainsaws or knives. Sorry, but we use hands. These healing hands.
I knew I came to the right place.
Yes. Yes, you did. Poor Romeo. Don't worry. Amputation is not the only solution we have. There are many treatments and modalities that you can do on a client with thoracic outlet syndrome to help them recover, in your office and at home. Some of these modalities and treatments are Swedish massage, deep tissue massage, trigger point therapy, myofascial release therapy, heat and cold therapy, acupuncture and acupressure, acu-yoga, orthobionomy, exercise and stretching, and magnesium intake. As you can see here pictured, I have the scalene trigger points. Here's the trigger point, and you can see it's referring pain in the pec, the delt, the arm, forearm, and hand. It does both anteriorly and posteriorly. I also have pictured acu-yoga, Swedish and deep tissue massage. Now there are stretches you can do at home, tell your clients, so their recovery is faster. I have a few stretches listed here. The scalene stretch, pec stretch, arm stretches. And it's important to let your client know, the more they do it at home, the faster they will recover. Now that's it for us today. Stay tuned next week when we talk about thoracic outlet syndrome part 2.